Hi friends, I am Dr. Abhishek Mishra. I am a senior consultant in orthopedics, joint replacement and arthroscopy. I mainly do hip knee surgeries including replacements and arthroscopies. I have an experience of more than 20 years. I have done more than thousands of such surgeries. So today we are here to talk about an important ligament. I would say one of the most important ligament in the knee joint. That's the PCL, posterior cruciate ligament. Now, all of us, or I would say most of us, would have heard about this ligament called anterior cruciate ligament or ACL. PCL is another ligament which, if not more important, then at least as important as anterior cruciate ligament. The good thing is PCL is less prone to tear or injury as compared to ACL. But I would say the injury to PCL is more debilitating if we compare it with injury to ACL. So what is PCL? Now let me just try to explain it to you. Suppose this is the thigh bone or the femur, and this is the joint surface of the femur, and this is the lower bone called tibia, and this is the joint surface of tibia. So basically there are so many ligaments within and outside the joint, and two important ligaments like this. The one which is in the front is called ACL, and one which is at the back is called PCL. And both these ligaments, they give stability to the joint, they give support to the joint, they give rotational stability to the joint, they don't let the cartilage degrade.